Okay, let's unpack this employee health insurance. For companies, it often feels like this significant fixed expense, right?
Mm-hmm.
You budget for these premiums, and then, well, you might see a large portion of that just go unused.
Yeah, it happens a lot.
And then add the complexities of administration, the paperwork, the slow reimbursement. It can become quite a burden.
Definitely.
But imagine a different scenario. Maybe a system where you primarily pay for the healthcare services your employees actually use.
Well, that fundamental inefficiency in the traditional models is exactly what we're digging into today.
Right.
And these materials you've shared from Flash Health, they introduce a potentially transformative approach. They call it cashless OPD.
OPD.
Yeah, just for clarity, OPD stands for outpatient department.
Yeah.
So think of it as covering those routine healthcare needs we all have, doctor's visits, tests, maybe medicine.
Got it. Everyday stuff. Okay. So our goal with this deep dive then is to really understand Flash Health's cashless OPD concept. We want to explore how it works, the actual advantages for both companies and employees, and maybe most importantly, how it stacks up against other healthcare models out there.
Right, across South Asia, Southeast Asia, even China and South Korea, we're drawing on both the Flash Health webpage and their benchmarking strategy document.
Exactly. Two key sources.
So let's start by maybe dissecting the problems Flash Health sees with the old way, the traditional OPD reimbursements. Their PDF outlines some key issues. What are the main pain points they highlight?
Well, one of the first things that really jumped out at me was just the time it takes for employees to get reimbursed. They cite like 10 to 15 business days for a medical claim. That feels like a long wait, especially if you've just paid out of pocket.
It really is. That can be a source of frustration for sure. And then compounding that is the surprisingly high number of rejected claims.
Oh, yeah.
Flash Health reports something like 30% of claims get rejected just because of paperwork issues.
30%. Wow.
Yeah. I mean, think about the wasted effort there. Employees filling out forms, admins processing them, then dealing with rejections.
Yeah, doing it all over again. And here's where it gets really interesting for the company side.
Okay.
They point out that a staggering 45% of medical insurance premiums go unused.
25%, nearly half.
Exactly. Nearly half the money companies are putting in isn't actually being used for healthcare by their staff.
That's a huge inefficiency, isn't it? It's like paying for a service that's only half utilized. Suggests a real mismatch between that fixed premium model and how people actually use healthcare.
Totally. And then there's the admin overhead of just managing all those claims.
Right.
Flash Health suggests companies spend about 35% of their admin time on this.
That's a big chunk of time and resources that ideally could go somewhere else, more strategic maybe.
For sure. So, okay, with those challenges